So, step 1. Prior to performing the assessment, introduce self and verify the client's identity using agency protocol. Explain what you're going to do, why is it necessary, and how to participate. Discuss how the result will be used in planning further care or treatment. So, ma'am, ako po si Nurse Jam and I am from APCAS and I will be here to assess your skull and face. So, pwede ko po bang malaman yung pangalan ninyo at ilang taon na po kayo?
Rhea Codes, 18 years old.
Noted po. So, step 2, perform hand hygiene. And lastly, provide for client's privacy. So, sasarado ko na po yung curtains. Step 4, inquire if the client has any history of the following: past problems with lumps or bumps, scaling, itching, dandruff, loss of consciousness, dizziness, or headache. Ma'am, pwede ko po bang itanong kung nakakaranas po ba kayo ng hilo?
Hindi naman.
Nakaranas na po ba kayong mag-seizure?
Hindi naman.
Nangangati po ba yung ulo ninyo? Meron po ba kayong nakikitang lumps or bumps?
Wala naman.
Wala naman. So, after that, we're going to inspect the skull for its size, shape, and symmetry. So, i-inspect ko lang po yung skull niyo. So, after inspecting the skull of my client, I can note that it's normal because it is rounded and it's often called normocephalic and it is symmetric. We can note any abnormalities if the client has a symmetrical skull shape. After that, we're also going to inspect the facial features, the symmetry of structures, and the distribution of the hair. So, ma'am, pwede po kayo dito. So, after inspecting the facial features of my client, I can note that her facial features is symmetric, which is normal, and we can note any abnormalities if our client has an increased hair growth. And after that, we're also going to inspect the eyes for edema or hollowness. Pwede po ba kayong pumikit? Pwede niyo po ba kayong Thank you. So, after inspecting the eyes of my client, I can note that it's within the normal range because it doesn't show any signs of edema. We can note any abnormalities if our client has sunken eyes or preorbital edema. And lastly, we are going to note the symmetry of the facial movement. We are going to ask the client to lower or elevate the eyebrows, close the eyes, puff the cheeks, smile, and show the teeth. Ang pwede ko po bang i-ask kung pwede niyo pong i-elevate yung eyebrows ninyo? Itaas niyo po. Pwede niyo po ba itong ibaba? Pwede po ba kayong pumikit? Tightly. Pwede po niyo i-puff yung cheeks ninyo? Pwede po ba kayong mag-smile? Show the teeth po. So, okay. Thank you. So, after inspecting the facial movement of my client, I can note that it's within the normal range as well because the facial movements are symmetric. We can note any abnormalities if the client has symmetric facial movements or involuntary movements of the face, for example, tics or tremors. So, after that, we're going to document the findings in the client record. Thank you po.